reason. We've put out some different press releases out in the Daily Journal and been on the radio and have been trying to talk about this and have some information on our Facebook, but basically it is concerning. We don't want the public to panic, but we want people to be aware. And obviously we know of some things that are happening right now in St. Louis. We do not have any confirmed cases at this time. People are on edge a little bit, and we do epidemiologic investigations all the time for different communicable diseases, and this will be no different. So the health department does disease investigation, contact tracing, and when warranted, we will initiate quarantines. Obviously in St. Louis, that's been a concern over the last 24 hours because someone broke quarantine. And that certainly is a concern. I will say that when we investigate diseases, 99% of the people that we speak to are very compliant and understand the importance of protecting the public. But there are going to be people who do not do that. In prior times, we have initiated court orders for tuberculosis cases, and we want to make sure to maintain the safety of the public at all times. Right now, the greatest risk is to people who are 60 and older and have other conditions. I see some people shaking their head. So other conditions such as heart disease, diabetes, certainly people who are immunocompromised, undergoing therapies for cancer are at most risk for this disease. We've seen things happen and play out on the coast. We've had several deaths already. The numbers are changing daily, and we're well over 500 cases of COVID-19 in the United States, one of which is presumptively confirmed in St. Louis, and they're waiting on CDC confirmation. So it is concerning. It's something we want to be aware of. We have exercised this already with Parkland in the last 2 weeks. They are ready. EMS is ready. I've talked with Mr. Tetrall. We met with school administrators, and they have pandemic plans and really discussed what it might look like for quarantines especially. We are encouraging businesses to look at those processes and try to find ways to allow people to telecommute if they can, but we understand, and of course we provide direct client services to the public. We understand that not every service can be done that way, but if we can find ways to work via telecommute, that would help for sure. We are also meeting with Mineral Area College and working with them on their plan, and really working with the nursing homes. The state inspects the nursing homes, so they've been providing a lot of guidance to them, but I know local nursing homes are limiting visitors at this time, and that is to protect the most vulnerable in the population. Any questions that I can answer right off?
I've had a couple calls on what if there is a problem, how will the information be disseminated, and is that something from our emergency management person? Is that something just from you? And then how does that get out to the public?
Yeah.
Daniel, how far are we ahead on that?
I'll explain that in the department reports.
Okay. And I've talked with our maintenance supervisor, and he is trying to soak up all the bottles of hand cleaner he can get and spread them all over the buildings, all the buildings. And I understand from Daniel that there's a limit on what you can purchase per store right now. There's a run on that stuff.
Yes.
So we'll do what we can on that and get those spread out. You've given me a very good list of things, precautions we can take here, and we're starting to move on that, or thinking about moving on that, so we get that with your help. So.
Yeah, let me address Mr. Engler's question too. So preferably would be that there's a joint statement between the people who are investigating the disease. So usually that's going to be the doctor's office.
Doctors, not
and us.
I
the
told
joint
him,
statement.
I felt confident we had a plan, I just didn't
Yeah.
know what that plan was.
I was visiting in the hospital yesterday, and I saw the maintenance staff go around cleaning every door handle, and on the door side you push, they were cleaning up high and low and making a very visible public display of cleaning all those contact areas. They were really making sure people saw them do that.
Good.
That's part of the deal.
So can you finish your comment then about how you're gonna contact everyone then?
Yes. So as of right now, we have not released any information about people under investigation or people who are being monitored for travel. I will say, since I've been in this room, we have developments happening right now at the health center, and I cannot give any extra information on that. because I've been in this room since that's happened. But we have no confirmed cases at this time. Confirmed cases will be released to the public, and we will do a full contact investigation and reach out to people who have been in contact. It's important to know that just being in the same room with somebody does not make you a close contact. You have to be, sitting within 6 feet of someone and, be there for 15 to 30 minutes. So there's been lots of concern and panic over that, but it's important to know that that doesn't necessarily mean you're in close contact if you're in the same room. Obviously, household contacts would be a priority number one. But I wanna reiterate that we do not have any confirmed cases at this time. I do know that we are doing investigations on people that are concerned at this time, but there are no confirmed cases. And again, these are developments that have happened just since I've been in this room, so I have no further information at this time. We have a Facebook, that's the quickest way to get information out, but we certainly have relationships with the Daily Journal, both of the radio stations, and provided what facility the testing occurs in, we would prefer to release a joint statement with them. Does that answer that at all?
So somebody asked me that a couple of cities have emergency calls to call all the residents, that will not be used, or is that what you're gonna
I'll
talk
talk
about?
about that here in just a minute.
Okay, yeah, I'm not saying that that's impossible, but that's how we are able to release
Listen down.
information. Yes.
Now, I've heard in some places there's a shortage of test kits. Do you have those?
We have 2 test kits at the health center. They are state public health lab test kits. We do not do the testing at the health center. However, if we have a doctor's office who needs to do testing, the person has to be approved for testing through the state, and then we will get that test kit to the doctor's office. Quest and LabCorp both are able to do testing at this time. They do not have to fill out the person under investigation form. Sorry, this is wobbly. Through the state. They can send that straight to Quest or LabCorp. That means that we probably will not get notification of a person under investigation if they send it to a private lab and it's negative. We will only get that if that's positive. We've encouraged the doctor's offices to let us know if they have anyone who they believe is under investigation or that they're going to test, but we only will get positives if that goes to a private lab.
Is that immediate results on the test kit?
It takes 6 hours to run, but obviously the state courier, there's some time for them to get here, but they have plans for emergent routes and emergent pickups, that type of thing. They have some priority levels that they
Okay, so
use.
6 hours after they get the notice you need a test, they can take that, but then what about the results?
It takes 6 hours for them to run when
Oh, they
they
have
get
to take
it.
it back.
Yeah. Once it gets to the state public health lab in Jeff City, it takes 6
Everything
hours
doesn't
to
turn
run.
red in your hand or anything like that, okay?
Right, exactly. It's not like a flu swab that, you go and get and it's immediately available.
And how much do you know about the contact methods or the transmission methods?
It's mainly person to person, so typically within 6 feet of someone where, someone's coughing, coughing, sneezing. Droplets are really the concern in the air from coughing and sneezing. However, the CDC is recommending airborne precautions in hospitals when people are coming into the hospital for testing, that they are put into a negative pressure room where there's certain ventilation systems in there, similar to what we've done and have always done for tuberculosis patients.
Any other questions?
I have a question.
Okay.
Yes, please.
And you may not know the answer to this, but should there be a positive in this area, and should that warrant a quarantine, who enforces the quarantine?
So,
Whose job would it be to make sure they don't, because it's my understanding the case in Creve Coeur, they broke the quarantine suggestion, so who would enforce that?
So that would be a coordination between us and the sheriff's office, most likely. Now, say that there is a positive case and we're issuing quarantines around probably their family members, because quarantine is for people who are not ill. Isolation is for people who are ill. We will issue a quarantine, and we plan to do that by official notification methods and document very well how those quarantines are taking place. I know that St. Louis County was speaking about what their process was last night, and there's been some concerns about what their process was. And we wanna make sure it's very clear to the public what a quarantine means, and we are able to do some things to help them stay in quarantine. if there are concerns about groceries and that type of thing, to the best of our capacity. But that would be a coordination. If we believe that there is a concern for someone that they're going to break quarantine, that would be a coordination between us and the sheriff's department. I know in St. Louis County, they said that they have people patrolling this person's house, so.
Quarantine's at home, is isolation in the hospital?
Yeah, if people, you mean if somebody's admitted to the hospital that has COVID-19?
Well, if you decide they need to be isolated and they're still at home, do you haul them to the hospital?
Not necessarily, it just depends, how sick they are. If they don't, that's a good question. So unless someone really meets criteria to be admitted into the hospital, they're probably going to be isolated or quarantined at home. Obviously in St. Louis County, you have a healthy, 20-year-old patient that doesn't have a real risk for severe disease and is not ill enough to be in the hospital. So she's been, isolated at home. But certainly people that would meet criteria for being admitted to the hospital plans to admit. So,
Anybody else?
14 days. Yeah. And I don't know if I've properly answered. The health center does have the statutory authority to quarantine. The director specifically, and then also the director of the Department of Health of Missouri. Any quarantines are not taken lightly. We know that that is a huge disruption in someone's life, but we also want to make sure to protect the public. And, there's been a lot of things happening in other countries where, I think the entire country of Italy is closed right now. They're quarantining people. Again, those decisions would not be taken lightly, and, any closing of a school or any other entity, that would be something that's done in coordination with the state. Yes.
County employees also have an option to teledoc with our current insurance. Tell a nurse, tell a doc. I know a few people that have used it and it's at no cost. It's usually only 25 cents for the prescription.
Okay.
That may be an option for the county employees as well.
Thank you. Mr. Goggin, I think you were first.
Yes, sir. I'm just curious. Obviously there's been a lot of mention. I think you've used some key words that this is very serious, a lot of concern over this. Where does the discrepancy fall between the concern of this versus something such as the flu? I mean, is it because of mortality rate? And if it is a mortality rate, are there existing factors that predetermine those people to be more susceptible to that virus?
Yeah, really good question. Because obviously there's lots of information out there right now on social media. And, the flu is very serious and it certainly kills millions of people per year. It has killed one of our residents this year here in St. Francis County, so it really does happen. But the thing about COVID-19 is that it was previously undiscovered. So when they say novel, that means new. So no one has any type of herd immunity. There are some coronaviruses that are like the common cold, and we get them and we get over them. SARS, MERS were coronaviruses, and COVID-19 is a new coronavirus. Right now, the mortality rate is much higher than flu. So flu is 0.1%. Right now, they're estimating somewhere between 2 and 4%, depending on where you're at. And that's going to change as we have more cases of coronaviruses and then what the deaths end up being. That rate is going to change, and it is a new virus, and they're still studying that. But it is certainly concerning.
They developed some advanced treatments for it too, probably.
Yes, yeah, they're working on a vaccine that's going to be about a year probably, according to the National Institute of Health, and they're working on getting antivirals approved. I will say, and this is something I kind of talked a little bit about, the situation that's happening right now in Washington State in the nursing home, where several people have died. If that happened for the flu, that would make national news. That is abnormal. We do have flu go through our nursing homes here and there, certainly. But to have that many deaths in one place, that's concerning. So, we do have to be vigilant. We do have to use, evidence-based information. CDC has great resources out there right now. And again, we don't want the public to panic, but we also want people to be really vigilant and do like those evidence-based and things that we tell people for the flu all the time: washing your hands, staying home when you're sick, staying away from those, if you are sick, that are most vulnerable, the people over 60 with those comorbid conditions that I spoke about earlier, because we certainly want to protect, our fellow neighbor and our loved ones for sure.
Jay?
Is that more respiratory
Yes,
than
yeah.
GI tract?
Yes, it's upper respiratory mainly. Symptoms are kind of vague. similar to other things, fever, cough, shortness of breath. So, right now, the concern would be if you have those symptoms, have you been in contact with someone with COVID-19? In Missouri right now, we do not have community spread. So that means that all of the cases that have been investigated so far in St. Louis County are people who have connection to travel related cases. So other places where there's an outbreak going on or there's community spread going on. That could change, and it could change really rapidly. And so our response methods may change. But I would really, suggest to, use those evidence-based information coming from the CDC. We're sharing lots of information out on our Facebook at this time, and certainly we will alert the public to any type of confirmed case, and we'll continue doing case contact investigations on people that we believe may have risk factors or may be positive. So.
Any other comments or questions? I've got to tell you, this lady's only had this job title for about a month.
And there's an international public health emergency.
Yeah, there you go. Well, we appreciate you.
We appreciate you.
And if you have any questions, I guess contact the health department.
Yes, please do. We are being inundated with calls now, but we're gonna set up one line for people to call. That way they can answer questions pretty quickly. And the state is also working on setting up a state hotline as well. And we'll put that out on our Facebook and put some information out when that happens.
Okay.
So.
Thank you so much. And Darryl, would you follow up with that?
Harold, may I just make one comment?
Yes.
What I've noticed going on here is that there are many sources of information, basically the same information being given out in different ways and different manners of speaking. It could be very detailed and clear. We're gonna be panicking, we're all gonna die. I think what's important as we listen to one source for all of our information, and that we remain kind to one another. We all know what's happened in Creve Coeur. It's important we be kind to one another, respect the distances, and care for our fellow person as we go through this time of uncertainty. Because as she stated, there are no immunizations, we have no vaccine at this time, so we, as a public, just need to be careful and kind. Thank you.
And Amber, I guess those vaccines come from people that have survived it and they have antibodies, is that the way that works?
The NIH right now is working on that piece. They take the virus and do, their testing on it, and they have to do trials, and then they have a big 6-month trial that happens, because obviously vaccine safety is a top priority. And so they've got the virus and they're doing some
Then they
testing.
gotta make several million doses of it.
That's exactly right, yeah, and I know that the NIH has said basically the fastest they can get that done is a year, and that is because of the extensive trials to make sure it's safe.
Daniel will talk about communication.
Right, and on that, as far as what, related to emergency management, and
Microphone, please.
we met last week, with Amber at the health department as far as discussions as far as what St. Francis County Emergency Management will do. Again, we'll assist them whatever they need as far as, whether we have to go help them deliver stuff. If somebody is, confined or isolated.
Dan's our director of emergency management, go ahead.
Right, and so we've been in close contact with Amber, and we're gonna continue to do that. So with the information that she's talking about on her social media page, we're pushing out on our St. Francis County Emergency Management page as well to folks as well. So as far as the communication side, as of effective yesterday, our mass notification sign up is up and live. I've currently got it on our website page on the emergency management tab. You click on the link, you fill out the required information to create your account, and you're in the system for not only the weather warnings and such that you can opt in to whatever warnings, watches you want to receive. But we'll also have that database in the event that we need to send out a mass notification to folks here in St. Francis County. I know with Park Hills and Farmington still utilizing the code red system, that would be something that if something needs to be sent out as well from the health department, we can probably guarantee on those folks sending information out to those folks in their database as well. So I will have a link for our mass notification system for the Grave Mobile Public Safety. It'll be on our homepage as well, and also push that out on social media as well. So, but as far as answering your question, that is what we will attempt to use as well as social media outlets as well.
So you go to sfcgov.org.
Click
go to
on,
what webpage?
go on to, right now you go on to the emergency management tab,
Okay,
or type in emergency in the search bar on the homepage, and it'll direct you to our page, and you'll see the mobile, the Rave mobile safety, and you'll see the information and the link to click on to create the account, but I'll have that on our homepage.
sfcgov.org.
sfcgov.org,
And
yes.
you get a notification, the sheriff's looking for you with a warrant in his hand?
No,
No, okay, all right, okay.
we won't, no,
Okay, anybody have any questions? Thank you.
thank you.
Any other departmental reports? We have a, Carrie, go
Sales
ahead.
tax report, 2.6, I think, or 2.8.
I'm coming up with that.
Oh, okay.
Okay, the treasury report, we were 16.39% into the